I recently looked up this issue around tilted pelvises and pelvic asymmetries, especially around the misinformation related to low back pain and pelvic floor dysfunction. One of the big media sources that first popped up on my Google search was Verywell Health, talking about how a tilted pelvis is an abnormal position of the pelvis and that it can cause and lead to low back pain. That is such bullshit. In a 2010 study observing 120 men and women, it found that 85% of women and 75% of men had an anterior pelvic tilt. And the rest had some variation of a posterior pelvic tilt or a neutral pelvis. All of these people in this group were asymptomatic. There were no issues. So pelvic asymmetries are very common and normal. Okay, so you might be wondering, well, those people didn't have symptoms to begin with, and how do we know it doesn't lead to these symptoms? Well, in a meta-analysis and systematic review that looked at 43 studies and compared people with back pain and no back pain, and what they found that there was no difference in their lower back curvatures, pelvic tilts, and other asymmetries, that they were highly variable across both groups. So it's really difficult, and really there's no evidence to support that having any of these asymmetries leads to, perpetuates, or causes any particular pain symptom, especially pelvic floor dysfunction. How would we explain the Paralympics then? Asymmetries like pelvic rotation or pelvic heights also really don't matter. In a 2023 study with 300 women that were studied, researchers used a fancy measurement tool of their posture to measure their pelvic alignment. And what they found was that pelvic asymmetries were normal and common and did not cause or contribute to symptomatic pathology. In fact, these researchers found that nearly 75% of the participants had asymmetries. And while we're on the topic of misinformation, let's talk about pelvic asymmetries related to weak hip flexors or too tight hip flexors or glute amnesia and all the other crap that's out there. Again, too much evidence to support that pelvic asymmetries do not contribute to tight hip flexors, inhibited glutes, weakness of the pelvic floor, or contributing to pelvic floor pain or dysfunction. And while I'm on this rant, let's talk about sitting and posture. So much fear-mongering out there about the way we should sit and stand and move our bodies. Well, guess what? That's also bullshit, because postural differences while we're sitting, there's a variety of them, and the best position to sit in is the one that you're most comfortable in. There's little evidence that supports prolonged sitting actually causes an anterior pelvic tilt or leads to lower back pain. Sure, the best advice around that is to tell people to move, take breaks. You don't have to do that every 30 minutes though either. In fact, getting some variability in your tissues, exercising regularly, and moving your body is just enough nourishment to allow you to do the activities that you want for how long you want them to. So never fear, you're not going to harm your body because you can't get into that perfect alignment, whether you're sitting or standing or bending or lifting. The most important takeaway here is that your body is adaptable. It is fit for purpose if we just allow it to, and reduce the fear around some of the things that we're doing, because the fear and the worry around movement, sitting, or doing the things we love actually changes our motor responses in our body and makes us work harder than we really need to. So go ahead and slouch in that chair, have a posterior pelvic tilt or an anterior pelvic tilt. It doesn't matter as long as you are comfortable. And of course, if you are experiencing pain with sitting or in any postural alignment that just doesn't feel comfortable, change it up. I'm not saying that you have to sit in that position and tolerate it. In fact, get some variety in and find ways that you can sit more comfortably. There's nothing wrong with that. Thanks for watching. If you want the real uncensored scoop on all things pelvic and sexual health, join me on Patreon. You know, in case YouTube thinks my content is a little too, spicy. Let's learn, laugh, and get real about your private parts together. See you next time.